The annual Tampa Bay Miles for Melanoma, Your Next Step is the Cure 5K, is coming up in 2 weeks, which means there's still plenty of time that you can sign up and you can help raise money for Melanoma Research Foundation. Here with us today are the race directors, Bernadette Boyle and Linda O'Brien. It's wonderful to see you, ladies.
So great to see you.
Yes.
Thank you so much for having us.
This is exciting. 2 weeks away.
Yes.
You guys feeling ready?
Oh, yeah. You know, this is when all the nerves start kicking in.
Yes.
It's like, what's sleep for the next 2 weeks?
Yeah, there's no sleep. Getting worried about checking all the boxes.
So melanoma, I think a lot of people in conversations that I've had, you think of skin cancer. But melanoma, especially ocular melanoma, is different. Can you tell me what it is?
Yes, so it's basically the tag melanoma. There is a freckle on your eye that is diagnosed through just eye dilated exam. So actually, you know, last month, November, was our eye dilated, awareness. And so people should be getting their annual checkups because it can be diagnosed quickly that way. And then it's basically sometimes they can watch it and see, and sometimes they know already that it's something more serious. And then there's, other treatments that follow after that. But yeah, it's a rare cancer, 6 out of a million. So it's not one that people hear a lot of. And when they hear it, they're always like, what is that? Because they've never heard of it before.
And I had never heard of it before, and Linda and Bernadette and I all met because, as many of viewers know, this was a story that I shared openly. My late husband, was diagnosed in 2011, and then he passed away in 2015 from ocular melanoma. And then we all met because we shared our stories, because each of you have a story also related to ocular melanoma.
Yes, yes. So my husband was diagnosed with ocular melanoma in 2008, metastasized in 2011. And he lost his battle in 2016, so we're coming up to 10 years. Lots of trials and, travel to Philadelphia every month for a couple of years. But, unfortunately, at that time, we've come a little bit further with some FDA-approved treatments. Sadly, though, with ocular melanoma, it's not a cookie-cutter type of cancer, so what works for one doesn't work for the other. So, unfortunately, in Joe's situation, he wasn't at that cutting edge anyway. And so, he was able to get into different trials, but unfortunately, that's the situation that I was in.
Linda is a survivor.
Yes, she is.
18 years?
It will be 18 years in January.
Yes, it's wonderful. That's wonderful. But we share these stories like this because that's why we go out and we do these races, because it is raising funds for research.
Research, exactly.
And going through your treatments, why is that research and those funds so important?
Well, because again, it's such a rare cancer. It's not like we can go get chemo and, kill the cancer cells. It's a blood-driven cancer, and we need the research for them to come up with the magic drug that will cure it.
Happen. Yeah, absolutely. Okay, tell everyone the details so that we can either, if they can't make it out to run or they can't make it out to walk, tell us how we can donate and be a part of this.
Sure, absolutely. I know that I think we sent you guys the QR code. So if you know that, there's also right here on the poster as well. But they can, actually go right there. We actually have our team. Your next step is the cure. So by using that QR code, you're going to our page. You'll see Linda and I on that page, and then just join team and.
Yeah, there's the page right there.
Yeah.
So thank you both for being here, and thank you for what you're doing for the research and
thank you so much for this opportunity for us to share.
Yeah, thank you.
Again, we appreciate it. Thank you.